According to the 2014 USAID assessment on pharmacy storage in Malawi, about 559 out of 732 health facilities have less than half of the pharmacy storage space required to meet the demands. This is said to be contributing to poor management of drugs. This is the reason why the UK and US governments thought of bringing together funds to cater for drug storages across the country. The UK government has injected about 3.8 million euros and the US government has bumped in at least 2.5 million US dollars for procurement of materials and installation of the pre-assembled pharmacy storage units. Head of DFID in Malawi, Philip Smith, says the new storage facilities will address some serious constraints to the availability of quality drugs for the people of Malawi.
Improper storage of drugs leads to drugs losing their potency, it leads to drugs being damaged, and it leads to drugs being stolen. So facilities like this that can be built very, very quickly will really improve the storage and the security for medical supplies and ultimately improve the health of ordinary Malawians.
USAID Mission Director says the new pharmacy storage will also help to reduce lack of accountability in the health facilities, adding that with the new modern storage unit, facilities will be under heavy scrutiny. He further adds that the pharmacy storage units will be taking only 2 to 4 days to install.
I think that this kind of storage facility is very important because it enables the government to safeguard the supplies that it provides to this kind of facility. We've had a problem in the past year. We've noticed that as much as 50% of all the drugs that we supply for malaria, for example, are disappearing from facilities without being used. And this is a serious problem. It's not just a question of people stealing from the government of Malawi, it's people stealing from the people of Malawi. And the people who suffer as a result of this are the people who are sick and require the medications and can't get them because they're not there. So we think that facilities like this will go a long way to curb the theft of drugs and to help the government better manage the supplies that it gives to all of these facilities.
For his part, Principal Secretary in the Ministry of Health, Magwira, says government will continue to commit itself in safeguarding the drugs and it will take to book all offenders.
The biggest challenge that we face in our health facilities throughout the country is lack of storage facilities. You may have seen in some of our hospitals that drugs are kept in overcrowded or small tiny rooms, corridors and other places, which is not good for medicines because they have to be kept at a certain temperature level. The other challenge is theft of drugs. So with such a facility, now I think that problem will be addressed almost maybe 99%.
At least 115 pharmacy storage units are expected to be installed in 106 health facilities across the country by October end this year. Chitedze Health Centre is the first facility to be installed with the prefabricated pharmacy storage unit. Miriam Kaliza, MBC News, Lilongwe.